Will tracking apps save the world or put humanity on the fast track to a surveillance state? Hello, everyone. I'm François Picard. Welcome to the France 24 debate. The planet's worst pandemic in decades has researchers and policymakers scrambling for solutions that can both preserve human life and restart the economy. With citizens desperate to get back to work, the talk turns to what's called contact tracing. It was effective in containing SARS and Ebola. It would mean the hiring of an army of tens of thousands here in France to monitor and locate all those who've been in contact with COVID-19 patients and to keep the rest of the public in the know. Enter the tracking app idea. It's been being worked on at the European level, but it still has flaws that need to be worked out. How do you prevent the system from getting hacked or governments from using the data to illegally monitor citizens? What if you don't have a smartphone? How will it work between countries? And as the French postponed the unveiling of their Stop COVID app, as it's being called here, last Sunday, Germany did an about-face and opted out completely from the European plan. That's because Apple and Google didn't want to share their data and didn't want to use Bluetooth technology. We'll be asking our panel about Berlin's decision and more broadly, after weeks of confinement and Zoom calls with family, Microsoft Teams office meetings with work colleagues from the kitchen table, and Google Hangout social study classes for teenagers, will humanity come out of this current crisis more empowered or more enslaved to technology? This crisis has even highlighted and perhaps accentuated what some are calling digital inequality. Those who have the means and the know-how to be even more plugged into our globalized world, and those left further and further behind. Today in the France 24 debate, we're looking at tracking apps and the road to deconfinement. Joining us, Anne Genoté, medical doctor and member of the French Parliament for Emmanuel Macron's La République En Marche party, joining us from the southwestern French town of Escamps. Thank you for being with us.
Thank you. Good evening.
You represent the French abroad, that's your constituency, including vast swathes of the Far East. We'll be talking and comparing, if you will, on this issue, what that means in the areas that you know well. Also joining us, she is north of Berlin in the town of Fürstenberg, Anke Domscheit-Berg, member of the German parliament for the Die Linke party, the party of the left's group in the Bundestag, where you chair the Digital Agenda Committee group there. Thank you for being with us.
Hello.
From Paris, attorney Jean-Baptiste Souffron. He's the former general secretary of the French National Digital Council, and you've been looking at this issue closely. Welcome to the show.
Thank you.
The France 24 debate, where you can join the conversation on Facebook and Twitter. The hashtag is called F24debate. Count on the Europeans to come up with a catchy name. Here it goes. It's called the Pan-European Privacy Preserving Proximity Tracing Standard, or PEPPPT. Don't ask me to say it twice. Catherine Viette has more on how that would work in theory here in France.
The French government is betting on Stop COVID, a contact tracing app to help fight the spread of the coronavirus. Use of the app will be voluntary. It's designed to warn users if they've come into contact with an infected person. But the app has proved controversial, as opponents warn the software could violate privacy and be misused by the government.
Mais l'on sait bien qu'une telle application, une fois dans les téléphones des citoyens, pourrait servir aussi, par exemple, à tracer des migrants, des immigrants, à tracer des délinquants, à tracer des citoyens qui ne sont pas en règle avec telle ou telle situation légale.
The app doesn't use geolocation, only Bluetooth technology, which sends a signal to other phones nearby, alerting those who are in close contact with someone who's tested positive for the virus. France's digital minister swore there is no tracking and the data would be anonymous and deleted after a certain period.
Il n'y a aucun problème de liberté publique avec cette application telle qu'elle est conçue. Aucun. Personne ne sait rien. personne n'a accès à rien. Et la seule information qui est disponible, c'est que lorsque vous avez été en contact, parfois sans le savoir, avec une personne testée positive, vous recevez une notification qui vous dit d'aller vous faire tester. Vous en faites ce que vous voulez.
Other countries have launched similar apps, including South Korea, Australia, and India. Most work by exchanging Bluetooth signals between phones over a distance of 2 meters.
Just to be complete on all of this, Tuesday we had a big speech by the French Prime Minister in Parliament explaining what was to happen on the road to deconfinement, how schools might be reopened, businesses would be reopened, face masks for all. Edouard Philippe, though, in the end, saying it's too early to talk about that digital app. Let's listen.
Un grand nombre de responsables politiques.
Many French politicians on all sides, including the President of Parliament, have expressed their concerns to me about smartphone tracing of COVID-19. They have questions about the impact on public and private freedoms. For the moment, given the uncertainties about such an application, I would be hard-pressed to tell you if it works and how it will work exactly. We will organize a specific debate, followed by a specific vote when the app under development works and before it is introduced.
And Janote, why the delay?
Because actually, after 11th of May, we are not getting back to the life that we had before 16th of March when the confinement started. After May 11, we are just moving to a new kind of confinement where it is much more based on our own responsibilities than the obligation of going through confinement. So that means that there will still be a lot of social distancing and a lot of barrier measures. So the application won't be that useful because we won't be using that much the public transport and places where we could be meeting many other people. That's the reason why from 11 May, immediately after 11 May, after when we open a little bit the confinement, there won't be any use for this application.
Are you sure? Because we heard essential workers last couple of days saying already, and the essential workers who have to use public transport and have no other means of getting to those jobs are saying already they're noticing an increase in the number of people.
It is true, and that is the reason why there will be some new rules on how to use and to commute with the public transport. And surprisingly, there will be much more rules after May 11 than there are now, because we need to set up and to define these rules all together with social partners, with the users. So that's the reason why. So yes, there is a problem with public transport, but I'm sure that we will find a way to use it safely with the correct social distance in between users.
Jean-Baptiste Souffron, you heard in that report the government insisting there will be no problem of civil liberties when it's eventually ruled out. Your thoughts on why the government is for now holding off on that Stop COVID app and whether or not it will work?
Well, obviously, the Prime Minister does not agree with his Minister of Digital Issues. It's very normal, since the idea of that app, which is, by the way, just a fantasy app, because everybody agrees also to say, many specialists explain that anyway, this app will not work and that it has very, very little chance of working, and it will cost an enormous amount of money. But anyway, there are two things.
Hang on a second. You're saying it won't work?
Yeah, of course, because it relies on Bluetooth and on a very specific technology within Bluetooth, which is, well, not very used today. Do you ask yourself very simply, how much money does it make to develop an app that will work normally on 40 million smartphones all over France, and even more if we take Europe into account? Ask yourself how much money, I don't know, Facebook, Google, or other app developers put in the development of such apps. You need hundreds of developers, to say the least, and you need a lot of money, not just a bit of money. And
But on that score, Jean-Baptiste, French newspaper Le Monde reporting that already you've got big companies that are in on this. Capgemini working on the architecture.
Are they the one who will pay for that?
Let me just go down the list here.
How much money are we talking about?
Dassault Systems will work on security.
The budget for developing such an app is in the hundreds of millions of euros. So who's going to pay? And when I say in the hundreds, I would say it's a minimalistic view. None of these companies as of today has a cash in order to pay for that. And on top of that, if you look at it, as of today, it's a research project that is being touted as a product for citizens and consumers. Well, it doesn't scale that way. You cannot take a research project from researchers and public laboratories and make it like in 3 weeks or 2 months, like it is a normal product that anyone will use in their smartphone. This is not like developing a website, okay? It's not like putting a web page somewhere, which, by the way, is already something difficult and costly if you take into account all of the accessory costs that it implies. But it's something very difficult to do that would take a lot of money, and which, by the way, is not even like probably would not even be efficient if it would work. What we see today is more a communication mechanism in order to avoid speaking about what is really needed, tests, masks, drugs, and stuff like that. And on top of that, it's very dangerous anyway, because even if it were possible, which it is probably not, and even if it were efficient, which it is probably not also, then it will be a great danger to privacy.
But Jean-Baptiste, you agree that to come out of confinement, we need, as the head of the WHO says, testing, and in this case, contact tracing. So you're going to need something. The South Koreans have it. They're using it in Singapore. Why can't we have it?
Well, in Singapore, it is not widely used, and it is not how they manage to tackle the infection. In South Korea, for example, the way they do it, contact tracing can be done 2 ways. Either you put something in the smartphone of people, or you hire people. You hire experimented engineers, doctors, who will trace stuff by hand. They will just ask questions, ask you to fill in forms, and try to understand who you have been meeting before being tested positive, and then they will publish. That's what they do in Korea, for example.
All right, I want to get Anke Domscheit-Berg's reaction.
Can use that list to know if they have been in contact with someone, but it's not because they have been tracking with their smartphones. It's because there are teams of people who actually try to understand who they have been meeting with. That's, by the way, what the government is actually planning to do today.
All right, so I want to get Anke Domscheit-Berg's reaction, but just very briefly, Ange, what's your reaction to that prediction that this will never see the light of day, this app?
No, 2 things. First, it's a tool among many tools, and the manual tracing through people has to be put in place, even if this is very intrusive. As a doctor, I can confirm that inquiring about who you have met for the last 2 weeks and who you were with for the last 2 weeks is very intrusive and very intrusive in your private life. And the second point is that regarding the money, it's not a question of money. Our president has clearly said whatever it costs. So the problem is not a problem of money. The problem is saving lives. That's it. Point.
Anke Domscheit-Berg, what's your prediction?
Well, I believe that the French central version will also not come to see the light, but for totally different reasons. I do not believe that it takes hundreds of millions to do this. I also do not believe that that we don't have enough software developers to do this, because some countries have done it in some way, and others are on their way. And there's already open source code out to see that. I believe that France will not be able to do it because this central version of an application requires cooperation of Apple, because they have to change something deep into the iOS system, and this will not happen. It will just not happen. And without that, the French app will not work. And also we have the issue of interoperability. It makes a lot of sense to have a system of apps to be interoperable to within each other, or between each other within Europe. And we have several countries now going the decentral way, which is not only Germany as a new country, it's also the Netherlands, it's Austria, it's also Switzerland, which is also one of our neighboring countries. And then we have the decision of the European Commission and of the European Parliament, which have been very much in favor of the decentral solution. And I heard that one French person saying that there will be no issue whatsoever. He said that in Parliament, and nobody can ever have inappropriate access to the data. But whenever you store sensitive data in a central database, it is vulnerable. That's it. And when we rely on people to trust in a system, because we need them to trust to use this app voluntarily, and only voluntarily will work, then you need to give them something to trust. And the most trustworthy system is a system where you don't need trust at all, because there's no danger of abuse of data because it's not stored centrally.
And how far along is Germany in developing that?
Well, Germany just switched a very few days ago. On Sunday midnight, they changed from a central approach to the decentral for three major reasons. One reason was that they could not secure a confirmation from Apple that they will change the internal system of their operating system. But the second one was there was an enormous pushback from scientists, from scientific institutions, from IT experts, from privacy experts, all saying that this central application is not sufficiently trustworthy to convince like 60% of smartphone users to download it voluntarily. And this very intensive debate in the media and in the public space led to a very rapid deterioration of trust. And without trust, you can't make the app have a positive impact on fighting the pandemic. And that's why the minister changed turn.
Anke Domscheit-Berg, let's talk about trust. The statement that was put out late Sunday by the German health minister said the app should be voluntary, meet data protection standards, and guarantee a high level of IT security. The main epidemiological goal is to recognize and break chains of infection as soon as possible. The app should be voluntary. Can it work if it's voluntary, or should it be mandatory?
I believe it can only work voluntarily because we live in a free society and not in some states where you can just tell people to first have smartphones, second, mandatory download an app, third, always have Bluetooth on, because if you switch it off, it's not going to work anyway. So how do you want to control this? It's not possible. It would be such an...
But will it work if only some people use it?
Pardon?
Will it work if only some people use it?
Well, it probably will have always a positive impact higher than zero, but a little higher than zero is not enough. So we need a lot of people. There's a debate about whether it's 60%, 70%, maybe 45% is sufficient, but you need a lot of people to take part. But there is one important thing for France you have to really consider. Looking at the figures, you have roughly about the same number of infected people. Something like we have 160,000, you have 166,000. We have 6,000 deaths, you have 4 times that much, 24,000. This does not mean that French people die easier from COVID or your healthcare system is so much worse. It simply means you do not know 75% of infected people in France. But if you do not know, how are you to push the button in the application? If you have such a Corona app and only 25%, if 100% use it, yeah, but 25% only know of their infection. If only they input the system, it's going to fail. And that has to do with the lack of testing. You have about 7,000 tests per 1 million inhabitants. We have 4 times as much. And that means we know a lot more how many people are infected, and then such an app makes much more sense. Yeah.
And Gente, it's been more than a month since President Macron promised stepping up of mass testing. It hasn't happened. There's been a lot of criticism over labs, particularly veterinary labs, who say they've been sitting idle and haven't had haven't been brought into the loop, if you will. Why is France so far behind on testing?
Okay, we are moving forward better and better. Yes, we come from far distance, but we are moving better, and there will be more than 700,000 tests per week by May 11. So we know that we come from far, but we are improving. So that will be done. Getting back to the app, I just wanted to add to that Mrs. Unker was discussing on present figures, on data that we have now. What we have now won't be what we'll be having once we release the app in about a month from now. I agree with her, if we can get through it. We have some problems with Apple. I perfectly agree with that. That is true. But if we have to move forward, we don't know yet if it can work or not, but we have to move forward. And then from that, what do we have? On the one hand, we have a device, an application that works on a medical data that is stored by someone who I do not know. I haven't voted for them. I don't know what their motivations are, which is Google, GAFA, Batix, on the other hand, in Asia. And on the other hand, in France, we have an app where actually what is stored is not the medical data, positive or negative. The data that is stored is, I've been in contact. I was in contact of this smartphone. That's all. There is no other data, no medical data is stored. So that makes a big difference. And who is storing the data? A state I have voted for, I have elected, I have chosen, and I can say no to that state through my parliaments. So that makes a big difference between the two approaches.
Anke Domscheit-Berg?
Yeah, this is an argument we have had very often in the debate in Germany too, but it's actually untrue because we have in opposition the central version and the decentral version. In the decentral version, yes, you have to trust Google, Apple, etc., but nobody else. In the central version, you have to trust Google and Apple, and additionally, you have to trust a governmental authority. And the data, as I understood, would be controlled by central health authorities, which you do not elect either. So it's not the parliament, which would also be very strange if parliamentarians had to look at this data. It's healthcare authorities, unelected. But the biggest problem where people use this wrong argument that it's not a choice between corporations and the government, it's corporations only or corporations and the government. And this should be made transparent, and the debate should always be open and honest and not use arguments which are actually not valid.
Jean-Baptiste Souffrant, you agree?
No, yes or no, because it's not a matter of trust anyway. I mean, trusting in the government or trusting in Google, what does it mean? I don't really see the difference there, because at the end of the day, the problem is not who will have the data, and it's not even if it will be decentralized. The trouble is with the social implication that would have such an application. What would happen is that we would suddenly go back to something that existed in the past, internal passports, telling us where to go, what to do, if we're allowed to go somewhere, and so on. Why would we apply this only in the case of fighting a virus and not, for example, for controlling unemployment? That would be a very simple. And then if it was decentralized, would it be moral to actually trace people who are unemployed? I don't think so. It's a matter of principle. It goes way further than privacy and right into habeas corpus. So it's something that should be opposed on moral grounds right away, and not at all being discussed in terms of efficiency or whether we should trust this or that in order to keep the data. We should not have that data point.
Jean-Baptiste Souffrant,
Jean-Baptiste
Souffrant, we had on the show a couple of weeks back Fabrice Epelbrun, who teaches at Sciences Po, big advocate of privacy rights. His language sounds a lot like yours, but he was sober about it. His eyes were open. He said, at the end of the day, if it's about saving lives, people are going to be willing to sacrifice a measure of personal freedom if it means being able to get out there and earn a living.
Well, I don't agree. It's not true. Just simple as that. Or people wouldn't go to war, for example.
And Gente?
It's a stupid argument. I'm sorry, but it's not true. It's not because you don't have. First of all, you don't have to sacrifice yourself in this. Second, it's not a war anyway. And third, well, if you don't fight for something, if you don't defend your morals, your principles, your values, what are you fighting for? What are you doing anyway? What are you hoping to achieve? So I think, as I've said, the efficiency is not even.
People have to pay the rent and they have to get out and work, and they need it. They're more interested in that at this point in time. How to get to the end of the month is what they're worried about.
Yeah, sure.
We are talking here about saving lives. I'm speaking as a doctor from my personal MG perspective. We have here to save lives. We have to protect the more vulnerables, who are our grandparents and the aged people. And here we're talking about one tool, as I said earlier, among many other tools, and the manual process of tracing, because tracing is essential. Once someone has been tested positive because he or she had symptoms, we have to make sure who this person was in contact with, to inform, to alert the contacts and tell them, please isolate yourself, confine yourself. That's the only way we have. We have no treatment. We have no vaccine. Once we get a vaccine or treatment, things will be completely and totally different. But today, it's a matter of saving lives and saving our social lives, saving our economy, saving our work. So any tools that would help us with the only data is controlled by the government. To me, the government, I trust my government because I have voted for him.
Yeah, but it's not true. We don't accept anything. That's the issue. That's why we decide to support the people who are old and sick, because we want to save them also. That's why, for example, we don't suspend civil liberties also. We don't accept everything, and everything is not acceptable, except especially when we're speaking about a fantasy app, because as of today, that's only what it is. What we need are tests, drugs, and masks, which we don't have. And it's very surprising to see that, for example.
So hang on, are you ruling out, Jean-Baptiste, are you ruling out contact tracing altogether?
What?
Are you ruling out the concept of contact tracing altogether?
The idea of contact, you have two contact tracing, okay? You have manual contact tracing, which is perfectly fine, which is done.
Any idea of how intrusive it is?
Works, by the way, which really works, and which is perfectly fine and does not harm civil liberties. And you have the idea of having automated contact tracing through smartphones, which doesn't work, is not provable, and would be a great harm to civil liberties and not only to privacy. Going that way is going away. We don't know where we will stop.
All right. I want to get to, before I get to you, Anke Domscheit-Berg, on this point, two quick questions for Anne-Genoute. First of all, from earlier on in our conversation, should it be voluntary or mandatory?
It has to be voluntary. And again, even if the app is used by a small number of people, it is still a useful tool. We know that. We don't need many people. Yes.
Second question, a practical question. What do you do with people who don't want to have a smartphone or who can't afford to have a smartphone?
But it's also you have in rural areas where we don't need the app because people don't have to queue up with the social distancing, which cannot be respected. So sometimes people say those who don't have the smartphone or the access to the internet maybe are not those people who have to queue up and take public transport. So we have to make a difference here. Anyway, also what I wanted to add to that is that on a medical perspective, manual tracing we're talking about, but please, as a doctor, I can show you the file that you have to fill in. There is no privacy respected here when you have to declare. We have 30 diseases that you have to declare. It is compulsory, it is mandatory. Look at the file, the manual file. There is no respect of the privacy here. So it's not a good reason. So here, manual process where you have to ask you, I have to ask you, where were you the 2 days before? And maybe you don't want to tell me that you were not with your spouse. So this puts here the problem of private matters here. Clearly, the manual process is very intrusive.
And on that point, they're talking about hiring between 20 and 30,000 people in France?
Mm-hmm. Yeah, if this will be helpful because, as you said, it is one tool. Manual process is one tool. The digital app is another tool. We need to use everything we have, the doctors too, and you go and see your doctor that can help you find trace other people.
Talking about fantasy drugs as was done before. This is just like snake oil application. That's it.
No,
let me ask Uncle Domscheit-Berg, what's the plan in Germany as far as contact tracing goes?
Well, we will have both. We will have, of course, the health authorities doing manual contact tracing, which also makes a lot of sense, but it, of course, has limits. not only that I find it really hard to remember whom I have seen more than 15 minutes in proximity of less than 2 meters 10 days ago from today, I will hardly remember. But of course, I will also never be able to name any person I probably sat in a subway very close by, because I don't know these people. If I'm queuing in a supermarket, who is this person? I don't know. So this is something you can never achieve with manual contact tracing, and therefore it is a good idea to have something else, digital, additionally to this process. But I have a real problem with the argument brought forward that there is a moral conflict between privacy and saving lives, because it does not have to be. There are contact tracing versions which are not intrusive, are not violating privacy, and also cannot be abused for any other uses like tracking, I don't know, illegal immigrants or whatsoever. It's just not possible. The concept we now rely on, the decentral and highly privacy respecting version of a contact tracing app, it will only have the data on your phone, and only a person infected will send a code to a central database, which will distribute this anonymous and every 15 minutes changing code to all the other phones. And only I, on my phone, can compare the keys stored on my phone with the keys I downloaded from the central server. Nobody else but me will have the control about who or which phone. I don't even know who it was, and I don't need to, who was close by long enough to probably infect me. So how can we use it? It's not possible. It's secure by structure, by architecture.
So Jean-Baptiste Souffrant, would you subscribe to what Anke just described?
Not at all. Once again, no, but it's true. Such an application would be dangerous. It's one thing to taunt after and again that it will work. As of today, it doesn't work anywhere in the world for real. People will not install it anyway. It will be buggy. It won't be maintained efficiently. It will not work, and it avoids talking about the real solutions. All right, manual tracing is a real solution. Having drugs, tests, masks, and social rules in place are a real solution, which should be enacted and are not as of today. Okay, that's something important. On top of that, such an application, whether it is centralized or decentralized, would have profound implications for our social lives. How long? Right. Once again, before it is used in order to control unemployed people or migrants or whatever, with a decentralized version too, no problem.
But you can't do it. You just can't do it. The way it is developed or will be developed, and you can already check some of the source code at GitHub. It's not possible to track immigrants or unemployed or any other people. It's not possible. And
that's just as if we're asking people who invented online video that it will not be used for porn. Well, of course it can be used for something else, and if it's doable, it will. The issue is that anyway it won't work very well. So whatever.
The only danger I see, and this is where legislation has come into place, is that third parties like restaurants, cinemas, parks, or whoever say you only get entrance into this, whatever it is, if you show me on your smartphone that you have the app installed. So like a social pressure obligation thing. This has to be prevented. That is a real danger, but you can do it. You can do a law which is prohibiting anybody from discriminating people on the basis on whether they have installed or not this app on their smartphones, because it also would mean to exclude people who have no smartphones, battery is empty and they can't prove they have something on it. This must not happen, but this is really the only danger I can see, and this is one which you can prevent from happening in reality.
All right, there is one country which has touted its model, and it's a model that to a large degree you can thank a 19-year-old for. France 24's Justin McCurry went to visit him last week. We're talking about South Korea, where they were even able to stage national elections a week ago.
It's election day for Ryan and his family. As the youngest child, he's voting for the first time.
2 months ago, Ryan created one of the most visited websites in the country, CoronaMap Live. It uses geolocalization to provide information about the movements of people who tested positive for COVID-19.
그래서 색깔이 3개로 분류되는데 이제 빨간색 같은 경우는 이틀 이내 확진자가 거기를 다녀갔으면은 이틀이나 5일 안에 그 장소를 갔다 갔으면은 오렌지로 보여주고 5일 이전에 갔다 갔으면은 초록색으로 보여주는 거예요. 이렇게 뭐 나이나 연령대나 뭐 이렇게 동선을 더 자세하게 볼 수 있거든요.
The government tracks infected people's movements using surveillance cameras and credit card records. This information is then made public. Ryan spent several sleepless nights at the end of February updating his website.
아주 자랑스럽고 우리들이 생각 못하는 것을 어떻게 저 생각해서 했을까 한 게.
The site has been credited with helping South Korea to contain the virus and, in turn, enabling the country to vote in the National Assembly elections. The number of infections is 30 times lower than at the end of February. All of the voting booths have been disinfected and polling spread out over several days to avoid overcrowding. All voters must have their temperature checked.
열은 없습니다.
They must also disinfect their hands and wear gloves and a mask. Those with a fever are shown to separate polling booths.
일단 현재 코로나19라는 그런 어려운 상황 속에서 지금 사전투표율이 역대 선거인 지난 지방선거나 대통령 선거 때보다 높게 나타나는 것으로 보입니다. 이는 국민들의 선거에 대한 관심과 높은 시민도가 반영된 결과라고 생각하고 있습니다.
Even those infected with the virus, along with the tens of thousands of people in self-quarantine, were able to exercise their democratic right, voting at specially designated times.
너무 가식적 아니야?
아니야.
어렸어. 종이도 몇 번 접어야 되는지 몰라가지고 2번 접어. 일단은 한국이 계속 대처를 잘 해왔고 지금까지 그 사회적 거리두기도 한 2달 전부터 잘 해와서 그래서 가능한 것 같아요.
Voter turnout reached a 20-year high. South Korea's government has warned that the battle against the virus is far from over, but on this day, democracy was the clear winner.
Once again, a reminder, Angenete, this is part of your, I guess you could call it your home constituency, since you represent the French abroad. Has South Korea shown us the way?
It depends what you're talking about. If you're talking about the way they have taken the very measures, the social distancing, yes. But in terms of tracing, I strongly disagree with the path they have chosen, where you have geolocation and you really private issues here. So this is completely different. And here we have to separate. This app you were talking about is only to stop any new chain of contamination. Measures, the very measures, the washing hands, the mask, all this is to avoid, to take some distance, to avoid being sick. The app is only to inform you that you have been in contact with someone who has tested positive. These are two different approaches, and both are useful. Both are needed. Korea has used both, but for one of them, the app, they have chosen something that we all disagree with, which is the geolocation.
The geolocation, I think the rest of the panel would disagree with that as well. I want to go around the room because we are running short on time and ask you each a personal question. When you come out of this confinement period, would you say on a personal level that you are, and I'll begin with you, Anke Domscheit-Berg, are you more empowered by technology or are you more a slave to it than you were going in?
Well, I am an expert on digital policy, which means I have been dealing with everything internet technology and digital for many, many years. So for me, actually very little changes. I was using all sorts of tools on video conferencing, messaging, etc. I was being able to collaborate with my team in home office before. So for me, not a lot changes, but I like to see that lots of very fast digitalization happens in education, in public administration, and this is a good thing to come out.
And will democracy be stronger?
That depends.
It depends. Angenete, you personally, you're able to speak to us through the magic of technology from the southwest of France today. But again, it's the question of, are we just going to be more and more slaves to our machines?
the question was the same when we first made books in the Middle Ages, when TVs and appeared, when then computers appeared, when smartphone appeared. And for all of these, I have the freedom. You know what? On my phone here, there's something here that is a switch off button. And this is my freedom to use the switch off button. And I still feel that I have the freedom to use the switch off button. And I'm very happy with that.
Do you feel, though, it's kind of changing humanity?
Changing humanity, as books change humanity, as TVs change humanity, as phones change humanity, many things change humanity. It is our freedom then to know how to use it, and I rely a lot more on my state to help me make good decisions rather than on Google and Batix on the other side.
Jean-Baptiste Souffron, in this confinement period, have you had the free will to hit the airplane mode switch on your phone and do a digital detox?
I think everyone can. That's something that's for sure, but it's less and less certain. There are many people today who cannot work without internet and a phone. So are they free not to use it? I don't think so. It's very dangerous to enter a path you don't see the outcome, especially when it's anyway not useful, whatever. So I would really oppose such an app on any grounds, whether it is decentralized or centralized.
You oppose the app. Do you feel personally, again, that you will be more empowered by technology, that those around you using those Zoom calls, being able to use Microsoft Teams or whatever to do their work from home, do you think this is a good thing, or are we just going to become more and more slaves to the technology?
I think we need to be cautious not to become slaves of the technology, and that implies the ability to say no sometimes. No, not only on a personal level, but also sometimes no, like on a more general ground. As of today, if we were able to say, let's put us backwards 50 years ago, if we were allowed to say no to nuclear energy 50 years ago, would we say yes or would we say no? We have to, there's a choice to say no. And sometimes, well, it doesn't sound very positive to say it that way, but saying no to such an app is to say yes to our liberties and to our constitution, our civil rights, and everything we've been fighting for probably 250 years.
All right, we'll leave it there. Jean-Baptiste Souffron, thank you so much for joining us from Paris. I want to thank Anke Domscheit-Berg for being with us from Fürstenberg, north of Berlin, and from southwestern France, Anne Genetet. I want to thank you as well. And thank all of you for joining us here in the France 24 debate. There's more on France24.com. You can also follow us on our YouTube channel and on Facebook.